Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones.
Okay, let's unpack this. Think about it. Someone needs mental health support, right? But then the very technology that's supposed to connect them actually becomes a barrier.
Yeah, it's a real challenge.
It really is. And millions face this as mental health services shift more and more online. So today, we're diving into this really critical intersection where, traditional multicultural competence meets this new world of virtual therapy. This whole shift to telemental health, it's opened up a lot of possibilities, for sure. But it's also, maybe surprisingly, kind of amplified existing disparities.
And created new ones, too.
Exactly. New challenges for diverse populations. It's just so important to remember, technology isn't neutral. It's not culturally neutral.
Absolutely not.
It often carries these embedded assumptions, about how we communicate, what privacy means, even how we ask for help. And what's really insightful here, I think, is that understanding these dynamics, it isn't just like a nice to have.
No.
It's completely essential if you want to practice ethically and effectively in these virtual environments. We really need to develop a heightened cultural sensitivity that's specifically adapted for digital spaces.
So what are we covering in this deep dive?
Well, we'll look at the digital divide, that access issue. We'll talk about how we can actually adapt interventions for different groups.
Okay.
We'll unpack some crucial ethical standards that have to guide us, and then offer some really practical strategies for, effective, culturally responsive virtual care.
That sets a powerful stage. So before we really dig into the challenges and the solutions too, maybe we should nail down some core concepts.
Good idea.
These aren't just definitions, right? They're more like vital guideposts for understanding this whole landscape.
Exactly. Like building a house, you need that solid foundation first. So let's start with cultural competence. This is basically having the right set of behaviors, attitudes, policies that let you work effectively across different cultures. It's about awareness, knowledge, and importantly, the skills to apply them.
Right. And building on that. Multicultural competence, especially in this virtual world.
Yes. Specifically for telemental health, it means you can effectively work with diverse groups by showing that cultural awareness, getting the knowledge, and developing intervention skills that are culturally appropriate even when you're online. And, our professional standards, like from NBCC, they really stress this.
And it feels like it goes even further now. It's not just being competent, but actively sort of supporting someone's identity through their culture.
Precisely. And that takes us to cultural sustaining practices.
Okay.
These are therapeutic approaches that actively work to preserve, support, and affirm a client's diverse heritage and values.
So helping them maintain their cultural identity during treatment.
Exactly. It's a core idea in the latest CACREP 2024 standards that's pronounced CACREP. It's really about nurturing culture within therapy, not just acknowledging it.
So we've got these crucial ideas about competence and sustaining culture. But then, like you mentioned, there's the tough reality of access, the digital divide.
Yes, and it's a huge factor. The digital divide is that gap, that stark difference between people and places that have good access to modern tech, especially reliable internet and digital literacy skills, and those who just don't.
And the goal is?
The goal is digital equity. That's the condition where everyone, every community truly has the tech capacity they need to fully participate in society.
So that means reliable internet, the right devices.
And the skills to use them. It's the ideal we're aiming for.
And when these divides hit people, especially in the marginalized communities, that's where intersectionality comes in, right?
Exactly. Think of intersectionality like different roads crossing. If you're facing challenges on multiple roads at once, maybe related to age, income, language, race, your path to getting care becomes way more complicated.
More than just one factor alone.
Much more. It's how these different parts of identity, race, class, gender, disability combine and overlap to create these unique, often compounded disadvantages. And the CACREP standards actually mention this specifically.
Got it. And just to be clear on terms, the services themselves.
Right. Technology-assisted services, it's simply mental health services delivered digitally. But crucially, ethical guidelines, like from the ACA, say we have to assess a client's capability first.
The capability
Across intellectual, emotional, physical, linguistic, and functional areas. Basically, can they actually engage safely and effectively using this tech?
Makes sense. And the last term, virtual presence.
Yeah, think of virtual presence as that feeling, that psychological sense of being there with another person, even through a screen.
Like how connected you feel.
Exactly. And how strong that feeling is can really impact the therapeutic relationship and the outcomes.
Wow, okay. Those definitions really highlight the complexity, don't they? And they lead us right into the hard facts about the digital divide. Let's really dig into the research. Who's being left behind here?
Well, the data paints a pretty clear picture of significant disparities. For instance, it's kind of startling, but something like 40 to 45% of Americans aged 65 and older don't have smartphones or broadband access at home.
40 to 45%.
Yeah. And it's not just about age itself. It often overlaps with things like hearing loss, vision problems, language barriers.
So multiple layers making virtual counseling tough for older adults.
Exactly. Then you look at race and ethnicity. Studies consistently show Black and Hispanic populations have substantially lower rates of computer ownership, broadband access, and digital literacy.
How much lower are we talking?
Often a gap of 20% or more compared to white populations in those areas. And this isn't just a number, it directly translates to less access to virtual mental health care.
And likely worsens existing inequities.
Absolutely. It's a really clear, impactful example of intersectionality in action affecting real-world access.
And it's not just race and age, is it? Money plays a big part, too.
A huge part. Socioeconomic factors add another layer of digital exclusion. People experiencing poverty just show lower rates of smartphone ownership, broadband, digital literacy across the board.
So economic disadvantage meets tech barriers.
Right, creating these compounded challenges that can feel pretty overwhelming for people. And then there's geography, where you live matters.
Rural areas.
Yeah, it's a tough paradox. Counties with poor broadband infrastructure, they often have fewer mental health resources to begin with.
So the places that could maybe benefit most from telehealth?
Have the least access to the tech needed for it. Think about the pandemic. Telehealth use shot up for many, but rural folks, older adults, and racial minorities, especially Black and African American communities, consistently used it less.
Just highlights those persistent gaps.
It really does. These digital disparities are stubborn.
Okay, so we've laid out these, frankly, quite stark disparities. What's the practical takeaway then? How do we actually make virtual therapy work for diverse populations? It's got to be more than just having the tech available, right?
That's the crucial next step, absolutely. And there's good news here. A lot of research, systematic reviews, meta-analyses, they show that culturally adapted digital mental health interventions do work. They're generally effective and acceptable for racial and ethnic minorities.
So adaptation helps.
It does. They show significant positive effects compared to just standard care. But, and this is important, we have to acknowledge the gaps.
Okay, what are the gaps?
Well, these studies often show higher dropout rates, higher attrition, and there's limited research for some specific groups, particularly Black and Indigenous communities, so definitely need more work there.
Right. So what does adaptation actually look like in practice, say, for something like online CBT?
Well, for internet-delivered CBT, or ICBT, research shows adaptations that focus on inclusivity and cultural relevance really boost user satisfaction and outcomes.
Like what specifically?
Things like diversifying the case stories used in the program materials, or maybe replacing idioms that are very culturally specific with language that's more universally understood.
Or using examples that resonate more with particular cultural background?
Exactly. Incorporating culturally relevant examples. It's all about making the content feel authentic and genuinely connected to the user's experience.
That makes a lot of sense. Are there specific, models or frameworks people use to guide this adaptation, or is it more just figuring it out case by case?
It's a bit of both, really. It's an art and a science, but there are established frameworks that help structure it. Things like the cultural sensitivity framework or the ecological validity framework. These have been used successfully in programs like Silver Cloud Health Space, which was adapted for Latin American students. And a key part of that was not just changing content, but actually involving users in the adaptation process itself.
Getting their direct input.
Critically important. Another really powerful way is through patient-oriented research, meaning you gather feedback directly from patients, from community reps, from clinicians on the ground. You use that feedback to make the materials more inclusive, more sensitive, making sure the adaptations truly reflect the lived experiences and values of the community.
So it's co-creating, in a way.
In a very real way, yes. And we also need to think about population-specific adaptations. For instance, culturally tailored telehealth versions of therapies like ACT acceptance and commitment therapy have shown promise for Spanish-speaking Latino caregivers. Potentially by increasing psychological flexibility, reducing thought suppression, things like that. The real key, though, is finding that balance.
Balance between?
Between staying true to the core principles of the evidence-based treatment fidelity and being flexible enough to make it work across different languages, cultural contexts, value systems. It's adapting without watering it down.
That sounds like a delicate dance. Okay, so beyond adapting the content, what about basic accessibility? How do virtual settings create unique challenges or maybe even unique opportunities for clients with disabilities? And what are our ethical duties here?
That's a great question. Virtual therapy is definitely a double-edged sword here. For individuals with intellectual and developmental disabilities, IDD, telemental health could potentially bridge some gaps in care.
Could help address disparities.
Exactly. But it absolutely requires interventions tailored specifically to their diverse needs. And we're seeing some really innovative platforms emerge, mobile apps, even VR, virtual reality.
VR for therapy.
Yeah, offering customizable, engaging experiences that can get past some traditional barriers. Think about AI, gamification. These can be integrated to boost engagement, provide personalized support, especially for clients with cognitive differences. It's kind of a new frontier for personalization.
Interesting. What about specific accommodations, like for deaf or hard of hearing clients?
That's a huge challenge area. Often significant barriers due to language and cultural differences. Some promising approaches involve integrated healthcare models with clinicians who are language concordant using telemental health.
But is it happening enough?
Honestly, research suggests many mental health facilities are still not compliant in providing effective communication access for deaf and hard of hearing individuals. It's a serious systemic issue that needs addressing.
And for older adults? Maybe with cognitive issues like dementia.
For them, virtual care programs really have to tackle technology access and digital literacy head-on. Education support strategies are key. While virtual care might make it easier to see specialists.
There are other hurdles.
Right. You have to pay close attention to things like information retention, making the user experience really clear and optimized.
So with all these specific needs, what are the professional standards telling us? It sounds like there's a lot more to consider than just having a good webcam.
Oh, absolutely. Our ethical obligations are very clear and baked into professional standards. Guidelines, like from the ACA, give specific guidance for technology-assisted services.
What do they require?
They mandate a thorough assessment of a client's capability intellectually, emotionally, physically, linguistically, functionally. This is super critical when you're serving diverse populations who might face multiple barriers.
So can they actually use the service effectively?
That's the core question. And furthermore, the ACA talks about website accessibility for disabilities, translation capabilities, basically ensuring your virtual front door is open to everyone.
And the multicultural competence standards.
And of course. NBCC standards on multicultural competence, non-discrimination, they fully apply to virtual service delivery too.
What about something like informed consent? Does that change in a virtual setting?
It absolutely can. We need to adapt how we approach informed consent, thinking carefully about how different cultural communication styles, decision-making patterns, even views on authority might play out differently online.
Subtle dynamics.
Very subtle. Virtual settings can alter these things. So practitioners need to adapt their approach to ensure consent is truly informed and respects cultural values and communication preferences.
Which means having interpretation resources ready.
Critical. Language interpretation, translation resources are vital. And it's not just about literal translation, it's about ensuring real cultural understanding of the concepts and expectations involved.
This really raises a crucial question for anyone listening, I think. What does this all mean for practitioners right now? What are the concrete steps we can take, and maybe what's coming down the line for culturally responsive virtual therapy?
Okay, great question. For immediate practical steps, comprehensive pre-session assessment protocols are absolutely key.
And this is more than just checking their internet speed, right?
Way more. Yes, technical access and skills matter, but you also have to assess those crucial cultural factors, like cultural attitudes towards technology, privacy expectations, which can vary hugely, preferred communication styles, any potential conflicts between using virtual tools and the person's cultural values.
And this assessment guides everything else.
It should guide both the technical accommodations you might need to make and any cultural adaptations you implement throughout therapy. And beyond assessment, we need to actively put environmental and cultural adaptations into practice for virtual therapy.
What does that look like?
It could mean flexibility in scheduling, accommodating different cultural patterns around religious observances, work, family responsibilities. Practitioners also need to think, how might this virtual format affect cultural practices, like maybe family involvement in treatment decisions, or a preference for building rapport in person first?
So sometimes virtual isn't the whole answer.
Exactly. Sometimes you might need alternative approaches, hybrid models, mixing virtual and in-person, or maybe partnering with community organizations that are already trusted within a specific culture. It's about true equity.
It really sounds like this demands a whole new level of training and ongoing learning for practitioners. We need to evolve our skills.
We absolutely do. Cultural competence in virtual environments needs specialized training. It has to address that intersection of culture and technology.
Going beyond the traditional models.
Yes. It has to include understanding digital disparities, the nuances of virtual communication, how to build that therapeutic bond through a screen across different cultural contexts.
And emphasizing those culturally sustaining practices we talked about.
Definitely. Practices that preserve and affirm heritage, adapted for virtual delivery. And because tech and our understanding of culture are always changing, ongoing professional development is just non-negotiable. Staying current with research on digital gaps, new accommodation technologies, and really importantly, ongoing self-awareness work for practitioners about their own cultural perspectives on tech and therapy.
So looking ahead, what are the big emerging issues or future directions?
Well, there are still significant gaps in the research. We need more evidence for culturally adapted telemental health, especially for underrepresented groups. We need to develop and document what works.
What else?
Also, our understanding of virtual presence, that feeling of connection across different cultures, is pretty limited. How do cultural factors shape that digital therapeutic relationship? That's a critical area for future study.
And new tech, VR, AI.
Exactly. Emerging technologies like VR, AI, mobile health apps, they offer exciting new possibilities, but they also bring new challenges for cultural adaptation and equity.
We need to be watchful.
We need to stay alert to how these advances might impact diverse populations differently, demanding new forms of cultural competence. And one really interesting, though complex, area is integrating traditional healing practices with virtual methods. That requires super careful thought about cultural authenticity and ethical boundaries.
Wow, what a deep dive. It is so clear that while virtual therapy holds incredible promise for expanding access, making it truly accessible, effective, and ethical for everyone, that takes a really deep, ongoing commitment to cultural awareness and adaptation.
Yeah.
It's about meeting people truly where they are, both digitally and culturally.
Exactly. And if we connect that to the bigger picture, it just means we have to constantly evolve our understanding, evolve our practices. The work isn't fundamentally just about the technology.
Yeah.
It's about deeply understanding the human experience in all its rich diversity as it plays out in this digital space.
As you think about today's topic, consider these questions. 1, how might the ideas we've discussed show up in your current work or role? And 2, what, if anything, might you want to approach differently moving forward in your practice?